On va se rendre tout de suite.
So we'll go to Taiwan now. Taiwan, where we will have Dr. I-Ming Parng, who is the General Director, Department of Management Information, Ministry of Health and Welfare. Doctor, hello, can you hear us well from Taiwan?
Yes, I can hear you. Can you see me?
Oui, allez, faites-nous voyager un petit peu. Quelle est la météo aujourd'hui?
What is the weather? What time is it? And how's the weather like?
It's cloudy day.
C'est bon, alors il n'y a pas qu'ici à Lavore, on a quelques nuages.
In Lavore, it's cloudy also. So it's a great honor to have your presentation in Taiwan.
Good day, my dear friend from different country. I'm I-Ming Parng, the Director of Information Management in Taiwan's Ministry of Health and Welfare. And it's my honor to share with you about how we apply information technology to respond to the evil COVID-19 epidemic. The coronavirus first broke out in Wuhan, China, just before the festival of Chinese New Year. We suffered very much from previous SARS outbreak in 2003. The experience helped us to react faster and take the danger more seriously than in other parts of the world. In response to the severe coronavirus outbreak in China as early as January 2020, the Taiwan CDC, Center for Disease Control, officially activated the Central Epidemic Command Center and quickly instituted approaches and actions such as the mask rationing plan, border control from the air and sea, proactive case finding through traveling history, case identification, and quarantine or isolation of suspicious cases. We apply information technology to enhance all hospitals look like bunkers or important army bases to keep away from nosocomial infections. We try to make everyone in Taiwan, no matter Taiwanese or foreign people, can purchase surgical masks very easily and to keep social distance effectively. Maybe you knew we have a very powerful cloud system to act as a platform of health insurance sharing for national health insurance. On the platform, both insured and health providers use smart card to be the identification tool. All computers are connected by virtual private network. Before the pandemic, according to this cloud system, our physician and the pharmacy checked patients' medical record, including pharmaceutical, examination result, surgical record, and etc. Based on the existing system, the National Health Insurance Administration extended the function from sharing health record to share TOCC to physicians, clinics, and hospitals. Travel history means inbound record from immigration department. Occupational means health worker, long-term care worker, and pilot and flight attendant. When we decided to let everyone in Taiwan can get facial mask equally and easily, the National Health Insurance Administration modified the cloud system to write down the purchase record and to keep everyone can buy 3 pieces of mask in 1 week at initial time, and now can buy 9 pieces in 2 weeks. Around the beginning of February 2020, for each traveler arrived at Taiwan, we can share their personal ID number when they visited physician. But it was very difficult to instantly correct the accurate contact information for example, mobile phone number, because all health declaration and the home quarantine process rely on handwriting and the paper delivery. At best, delivered by email and recorded by the Microsoft Excel spreadsheet. Day by day, the traveling alarm areas and the population expanded from China to other parts of the world. It means the original artificial process may be collapsed at any time. We decide to set up a comprehensive data flow and information system from immigration gate to living community to offer home quarantine people for health declaration, civil service, and health service and decision support. We realized the time and the virus did not wait for us. We launched the following system in a very short term. First is a quarantine system for entry. On February 16, we launched this online system. Travelers with smartphone can log in the entry quarantine system by scanning the quick response code while waiting for check-in or landing taxi. Travelers can complete the health declaration online while waiting for their flights or upon entry. The information of health declaration includes name, birth year, identification number, passport number, mobile phone number, health condition, and the traveling history. The notification page for passengers' health declaration received by us will be sent to the passenger's mobile phone by text message when he arrived to airport and walked to the custom gate in Taiwan. After that, the traveler will get faster immigration clearance by showing the notification of health declaration. In brief, traveler can complete the health declaration and get quick immigration clearance with 4 simple steps. Scan the quick response code, fill out the form, get notification page of a health declaration via text message, and show the page on mobile phone to the health office. This system provides travelers to input correct and effective personal contact information over mobile devices, which highly improves the data quality and following severe and health service. The second one is the epidemic prevention tracking system. Along with the quarantine system for entry, we created a management system for severe and health services. We passed the electric information collected from entry quarantine system to different level of severe affairs and health authorities. For village level, the officer can call by telephone or on-site visit to track health condition for people who should be home quarantined and coordinate their living or health necessary and demand. For example, meal supply, garbage disposal, physician visiting, etc. For city or county level, the mayor or city government can monitor the total quarantine situation and plan the resources allocation. The policy, the police department also gets the information automatically for over necessary assistance to civil and health service officers. We extended this system service from home quarantine to group quarantine and dorm of foreign students. It assists the 14-day quarantine policy work and implemented. The Central Epidemic Command Center hold all real-time data and confirm all standard procedures are solidly acted. At the same time, mobile phone number can be used not only for case contact, but also for carrying out home quarantine. The third application is electronic fence system. We cooperate with mobile phone service corporation to understand the home quarantine people whether stay home or violate the rule. In case the rule is violated, the system will send a text message to notice and remind the case should go back home as soon as possible. If the case still does not follow the alarm notice, the system instantly sends an instruction to policemen. Policemen will visit the guy. This technology is a phone-based application that uses location tracking to ensure people who are quarantined stay in their designated location and allow authorities when home quarantined individuals leave their designated location or turn off their mobile devices. Another application is a robot system. Moreover, on April 1st, in order to reduce the working load for daily tracking home quarantine case by phone call or on-site visit, we also team up Taiwanese electronic brand HTC Corporation and the most popular social media app, Nine, to create a fully automatic online platform that allows people in home quarantine to submit reports or requests for their health and living condition and obtain health knowledge through the bot. The bot also offers free amusement, including music and video stream service. We initiated a user certification survey at May. The full score is 10. No matter the severe service over the bot, the score is higher than 8.5. I'm proud of this result. It's the data flow as I show you. Most IT applications I introduced today have services for more than 8 months and almost are modified and upgraded every day at the first 3 months. The amount of data exchange over users is listed for your reference. But the population number Taiwan is a wrong number. I'm sorry. The real number is 23 million. 23 million, not the 2.3 million. It's 23 million. I'm sorry for the fault. We summarize our strategy and experiences to 2 websites in English for international friends, as shown in the final slide. It's my pleasure to attend this meeting and share with you. Thank you. Thank you very much.
Merci
Thank you very much, Dr. Parng, for this presentation, which was quite impressive, very impressive in the things that you did in Taiwan and the results that you got. So thank you very much for sharing that. So this is yet again another example. We had example from Africa, an example from Asia. So we are very remote, but we also share a number of joint concerns. Now we're going to take the different questions for Samir, Julie, but also Dr. Parng. So there's the first question here on my tablet, maybe for Samir. They say, hello, I have a question on your study. How is it possible that in so-called developed countries, technological solutions was not able to stop the pandemic? Answer. Well, there's a debate at the level of the European level at large, and not only in France. There were many efforts that were undertaken. There were a number of analyses that were conducted in eHealth. We focused very much on Africa and countries from the south, but I think that the physical infrastructures, we were lacking those physical infrastructures in Africa, and for this reason, devices like smartphones or mobile phones became all the more important. And this explains the very good results that we got and the good adoption rate that we have. Because obviously we focus on COVID crisis today, but there are other areas in which those devices are very interesting, for example, in the fight against malaria or in the prevention of infant mortality. In Africa, more often than not, a computer or a mobile phone is the only way for you to get in contact with a medical professional. You know that in those countries, it's 1 day worth of travel to a hospital or a healthcare provider. It's difficult to also access hydroalcoholic gel. So really those applications in Africa are a lifeline, and they are the only way to connect to healthcare providers. So my answer to the question will be the following. The reason why there is a gap between the use of those technologies in countries of the South and the adoption that we have in so-called developed countries, it's just that there are no alternatives in Africa or countries of the South. A mobile phone is the only tool which make it possible to have screening or to access healthcare professionals. For example, in Kenya, the application that we talked about is a free-of-charge application. It's supported by a startup, and they equip a number of community-based providers in Kenya. And again, most of the time, those smartphones become a lifeline. It helps with access to healthcare, especially for people with a less privileged background. We don't need that type of infrastructure in France because we have so many other options. And so it's quite paradoxical, but this is why I explain, and this is how I explain that there was a lot less adoption. And this is also why I explain that technology, mobile phones in medical deserts in southern countries is really a question of life and death, and this is why there is so much adoption and potentially less adoption in the north, because in the north we have other options. We do not need those lifelines, and I think this is why we do not have a one-size-fits-all solution. Now, I have a question for Dr. Ming Parng in Taiwan. We see that the system that you implemented was very efficient, and it was thanks to digital equipments, thanks to mobile phones, and I suppose mostly smartphones. So does it mean that 100% of the Taiwanese population has a smartphone? Don't you think that maybe some people were excluded from your system? Do you think it's the best way to communicate with population?
Yes, in Taiwan, the number of mobile phones is more than our population number. But for somebody just like a very young kid and very old people, maybe they cannot use mobile phone. So in the system, we connect with their family member. Even the kids don't have the mobile phone, but their family member can have the mobile phone. So we connect their family member to keep them away from violate the home quarantine rule. another very important infrastructure is the national health insurance. In Taiwan, even very young kids, they have the smart card of health insurance, so they can use their smart card by their family member to purchase the mask. So everyone can very easily get the mask.
A microphone will also be circulating in the room here in Lavaux if you want to ask questions to Dr. Parng or to the other speakers. There's another question for you, Dr. Parng. Your system is also based on data collection, so massive data collection, also a follow-up and also tracking of individuals. Is it well accepted by the population, the fact that so many data are collected?
Yes, we have to follow the privacy law. So the data we collect only can use, for example, maybe 28 days or 14 days, and after the day night should be deleted. So we should follow the law.
I also have this question for Julie and Samir. There will be a discussion today. So we talk about e-health being a way to access health services, but we see that today e-health is not only access to health, but also data collection and how we're going to leverage this data. We do see with Dr. Parng that countries like Taiwan have an infrastructure to do so, but society is also ready for that. Now, of course, we need to have a legal framework to really frame the use of this data. So what would you be your point of view? Because this is a question that is still a hurdle in northern countries. So what would be your take on that? Yeah, we can think about the Stop COVID app that we have in France, which was not widely downloaded by French citizens because there was no acceptation by the French population. Well, I do see also the experience that we've had so far. Systematically, this is a question that comes in the forefront. How citizens are very concerned about the safety of the data. They want the data to be encrypted from end to end. They want to be sure that the data remain anonymous. They want to make sure that the data are safeguarded and protected. So it's true that with our health-related data, they are pretty sensitive by nature. And this is true that this is a question that we keep hearing when we go at grassroots level. And most of the time, we do have an approval from the state, but we have a hard time with our populations. And it's also questions that we have in Africa. Obviously, we need to have a strong partnership with between the population and the government, and we need to have this reassurance. And we see a number of projects, not only during the COVID crisis, but when we try to, for example, to prevent infant deaths, we have a number of projects in this area as well. The first step, if we want to boost such projects, is to have partnerships with communities or partnership with local authorities. Again, every time we want to have a follow-up and every time we want to collect information, we need to be backed by the government. So we first need to be supported by this, and then we can scale up our solutions. Maybe there are questions in the room, says the moderator. Can you please introduce yourself before you ask your questions? So as I explained, for health reasons, you can't take the microphone in your hand. I have a question for Taiwan. I'm going to ask this question in English.
This is a question for you. Thank you very much for your intervention on what happened in Taiwan. I was intrigued when I saw the information flow on your slide. Interoperability in your health information system is obviously crucial to be able to collect all this information and analyze it in real time. I'm curious, in Taiwan, this is a major challenge for most countries. You know, this is foundational and part of a national digital health strategy. How long did it take Taiwan to be able to get all of this foundation of interoperability between all of this information flow you described? And what sort of investments was needed for this? Thank you.
So this question, I hope, was heard by you, Professor Parng. So we would like to know how you work, maybe in between ministries, to help with data circulation.
Our data used only for home quarantine, and is regulated by the privacy law, and we should summarize our data utility reported to our parliament. So it's under legislative department control.
To add on to that, you said that you have a cloud-based system, which seems to be at the center. Is this cloud hosted in Taiwan, or did you use international clouds like Azure from Microsoft, for example? So where is your cloud hosted?
No, only in our data center, yes.
So you have local data centers, is that right?
We have Taiwan's data center in center of the center. Our data center is in CDC.
Last question from the room. I do see a show of hands. This will be the last question for this roundtable. Before we talk about the award winners, the gentleman here would like to ask a question. I have a question. I'm Dr. Drago from Burkina Faso. I really liked the presentation from Taiwan. There was a question about the data privacy, and I was very happy with the answer. Now, when I look at the workflow from Taiwan for entry on the territory, there was a QR code that needed to be scanned before the person received a text message. I wanted to know whether this was an Android-based system or whether it could be used with other platforms.
Merci, Dr. Drago. On pose la question au Dr. Ming Parng. La question,
Dr. Parng was how did you manage from a technical point of view? Was it an Android-based platform? How was it only available on Android smartphones or all types of smartphones?
Our system is platform independent. Yes, it's a web application, not an app. We have studied if we apply to app, should be uploaded to iOS or Android, and the review date for upload is too long for us. So in the early time, our application is modified every day. So as I have presented, so we upload our system for platform independent, and it's a web application. Your mobile phone or computer have a browser can use our system.
Thank you very much, Dr. Parng. Thank you very much. Congratulations to all of you. Thank you for those examples, very concrete.